Welcome to your rescheduled policy committee meeting for February. As always, we'll start with a quick round of introductions, starting to my right, your left.
Stephanie Scott, Assistant General Counsel for CPS.
Mike Morosky, Board of Ed.
Eve Bolton, Board Member.
All right, we got a big agenda as always, so we're going to dive right in. Now, our first agenda item, those of you who have tuned in are aware that we asked for an audit of 4 policies in the district that are instrumental to our functioning in an equitable and effective manner. And we are going to get a report out today, but I don't see our people here. So we're going to skip this agenda item and then come back to it. And people who are smarter than me in the audience are nodding and saying that's right. So I am listening to them. We will move back to that. The next piece is something that we talked about briefly at the last meeting and then kind of at length at our full board meeting that we're bringing up again. And this is regarding Board Bylaw 0160, which is meetings, specifically 0169, public participation at board meetings and hearing the public. At the full board meeting, we discussed the issue of now that we're back in person and virtual, does hearing of the public, does that right extend to people who are virtual and who are in person? Of course, in the past, you had to be in person to do it. We've elected to continue to allow both, even though to the best of my knowledge, thank you so much. To the best of my knowledge, we haven't had anybody actually speak in person, or maybe just a couple. So I'm going to open this up. I know it seemed the consensus of the board was that people were fine with both. But I'll open up to my colleagues if they have any comments. And then I have a question for General Counsel after that. But are there any comments from Ms. Bolton or Dr. Moffitt about this part?
Yes. First of all, I don't know that the public knows, and maybe we have or haven't, that we actually are in person in our board meetings. And I don't know if we should maybe assign public affairs to make that more obvious or what have you. I know we've limited the number based upon space, but again, the space issue might be different. So I don't know if we might first want to make sure that's taken care of. I think that would be great. I have several things. I particularly liked the way that the General Counsel, I believe, dealt with the issue of that we cared a lot about, which was the students speaking. I thought that that gave some deference without necessarily making it quite so extreme in providing them an opportunity. But I have a couple of additions, not surprisingly. At the very top of the policy, where it says school governance, I don't know if we're using that as some sort of very universal issue, but it should also be district governance. From a standpoint, it's school governance is, unless it's a universal term, I just think that limits it, and it sounds like we don't want to be advised from a district standpoint. I thought that would be, and it also says school matters. I think those would be some things that I would suggest. And then the 5-minute rule for is you can only sign in the first 5 minutes. I think the community has always felt that was rather exclusive. I don't know if it's 10 minutes. I don't know how many minutes if you're in person. Our staff sits there at the door ready to have people sign in, but I know it's longer than 5 minutes. So I think if we could look and at least make but I don't know if there might be a technological reason why it has to be done so early for the remote. Yeah.
Go ahead, Mr. Hoying.
Thanks. No, the policy when we were in person only, the rule had been, I believe, and Phyllis and Pat can confirm, but that you had to sign up in person before the start of the meeting. So the policy had read that you have to start before the meeting. That's not possible virtually because I think we need to have some time, and that's why we introduced this sort of 5-minute rule or 10-minute rule. But that can be adjusted. That's at the board's discretion.
That would be, if it's similar or whatever, or it's comparable, I just think that would be a better way to go. We're looking at board staff now, they're nodding, she's nodding her head. 10 or something like that, that'd be great. And not to belabor too many things, there's the board shall provide a hearing of the public. We don't always do that. Is shall the same as will or rather than may? I mean, sometimes there is not time. Sometimes, I mean, we would hope that we would, but I can think of some instances where we didn't do that. And I believe they were good reason. But I don't, you know the words better than I on that stuff.
From my opinion, I agree. I think there are some times that, for whatever reason, the board has not done hearing of the public, and I hate to have that as, for us to be caught up. And so we can use a different word that, shall generally or may, I think works also.
Then down at the board encourages students to speak. I think that was all pretty good. As I said, I like the way that we're strengthening it without necessarily, and we might want to make it stronger. I got a little concerned on the A, presiding officer of the discretion, the duration of hearing of the public between, 1 and 3 minutes. That's okay. But then there's this next thing at the discretion of the presiding officer, one representative from each CPS's employee groups may be offered additional time to speak. I think that's going to be looked at as something negative rather than positive. And I don't know I don't know what we're trying to achieve there, that we're extending, is it the leadership of all of the unions or it's an employee group?
If I may.
Yeah.
So I had, and then this just ties right into that, so then it doesn't have to come up again later. It was related to my question. I respect the intent and the heart of it, considering we let President Sellers speak for as long as she wants. And so to me, it struck me that if there was other leadership that wanted that same sort of leeway, it makes sense to me. The only concern I had with not calling it out as leadership specifically is I think it could potentially cause issues if you have people of other employee groups. They just kept talking and then they could come and say, well, your bylaws say. So I think just me having leadership, if Renita wants to come, Rick wants to come, whoever it is, I think they should be afforded the same opportunity as Julie to speak as long as they want. But mine was more of the wording too, but I just wanted to throw that in lower.
Maybe if we can just review that paragraph and see what we're trying with. We're wanting all of our, I think I can't recall on the collective bargaining agreement if that's a collective bargaining agreement win for CFT or it's a history or tradition. But yeah, we would encourage, just as we would encourage other people to speak, we encourage our other union folks to speak. I got, if down at the D, I'm concerned about same household. That's like a husband and wife can't come in, or partners can't speak, or kids and parents. It just sounded weird to me.
We share that same concern. I think that that's diving a little too far into the weeds. I think A and D do the same. I think the intention when I heard about this was that we have no one group be dominant in a conversation. So we wouldn't have 10 people from group XYZ calling about the same issue. That was the intention, that we wouldn't have them take up all of the time on one particular topic and not give space for other voices to be heard. But I do think that to say same household, I think that's a little limiting. And then I also think with regard to one representative from the union, I don't know, have the other unions been invited to speak? I think that knowing that you can do something is completely different than doing it. Maybe the reason why they're not is because they have not been invited. So I think things need to happen concurrently. We need to invite them to come and speak at the meetings. Their officers, the representatives, formally invite them, and then look at maybe what that looks like. Do they get the same as our CFT member leadership to speak unlimited? We can speak to that, but I think that we need to first and foremost extend the invitation. And if they don't take us up on it, then that's their choice, but we need to do that. And then if they have members that would also like to speak, I don't think we need to stop that from happening. And maybe instead of saying same household, same topic. So once we've heard about a topic from 3 members, we limit it to that, from 3 people, participants. And I also want to encourage the public that are watching. I think, Rob, you put it up on the board, but all of the documents that we're looking at, are they available for people to review so that they can see what we're seeing? They can actually look at policy 0169, public participation at board meetings, if they're interested in looking at what we're looking at. They don't have to search far. Those documents are available, so they can look that up. The only other thing that I had a comment about was with regard to the students being able to speak. That was a big one for me. And I would like to make sure that we do give that space. I don't even want to limit it to the number of students that can speak. Now, the topic is different, but I'd like to have the first 10 minutes. 5 minutes seems a little limiting, but if we could extend that to 10 to sign up to speak, I think that would be a little bit more gracious. And see how that goes. But I'm open for submission.
I'm glad that you brought that up, because I was going to ask how you felt that wording was, because I know that was important to you regarding the student piece. So it sounds like there are a couple of assignments. We're not ready to move this to the full board. A little bit of research into the historicity regarding Ms. Sellers being able to speak longer. Was that a win in a collective bargaining negotiation, or is it just something that has sort of de facto been the case? Looking at the wording around the leadership there, looking at within the first 5 minutes, I would just throw out 15 as a decent amount of time. Unless anybody has another idea, I think 15 is fair, and it still gives, Rob, Dan, and whoever else is coordinating it time, I think, because we are sure there's no board meeting where we're getting the hearing of the public in 15 minutes. So we could make it an hour if we wanted to, maybe. Either way, I heard that. And then Dr. Moffitt, is there anything that you would want to affect about the paragraph with students, or like add it in there, or are you happy with sort of the way it's worded today?
The way it's worded today sounds pretty good to me. We've never really done this, so I kind of think that we should try it to see how it goes, and then if it ends up being a complete debacle, we'll come back and maybe revise it. But I think this is a good start.
And the other piece was, and this would be an assignment from Ms. Bolton to the communications team that I will adamantly second, that we need to make it very, very, very abundantly clear that our meetings are open to the public. Very abundantly clear. So let's do that and see where we land. Are there any final comments before we move on?
I would just add that as I think President Lindy and the full board are looking at ways, once we get through this bigger job that we have before us, looking at ways to improve board meetings. It does make sense to move the public speaking earlier in the meeting, not just for the kids, but rather, since our meetings are often lengthy, and even the front half of it or the front third is so long, it is frustrating to the public. And we used to do that. It used to be early in the meeting, But then when we had very big issues before us, there was an interest by the board to, can we at least get some of the information out, particularly about whatever is most significant. But I think that's outlived its usefulness. I think council does the right thing by letting the public be first, and but it is during an actual commenced meeting, because that's the other thing elected officials might do. Okay, we'll let the public speak, but we won't be in our chairs. So as long as we watch that behavior, I think we can maybe suggest that as something to at least talk about.
Awesome. I agree. So we're good. We can move on to the next agenda item. Wonderful. Continuing with our audit of our own audits as we look at our policies and sort of clean them up. General Counsel has brought before us policy 3141, retirement.
Yes, this
So
continues.
Yep.
This continues our review of the human resources series of policies. I'll bring these up on the screen. The first is retirement. The only major change we made with respect to that policy or update we did relates to a provision of the Ohio Revised Code that says when you bring back a retired, a reemployed retiree, someone who's retired under either the STRS or SERS retirement system, there's a requirement to have a period of notice and a hearing. We've gone through that a couple of times with reemployed retirees. Other than that, no other changes to this policy. Glad to answer any questions.
I'll look to Ms. Bolton, Dr. Moffitt. Ms. Bolton, to our hands.
I have no questions. I think it reads well, but General Counsel might want to share what that requirement is.
Sure. So it's actually, and I think I've got this. It's in Ohio Revised Code 3309.345, a retired superannuate or something like that. It's a vocabulary word, a 10-cent vocabulary word. Essentially, it says that when the board, when any board or public entity in Ohio is going to bring back a reemployed retiree, you'll see there in B1, it says not less than 60 days before the employment, you have to give public notice that the person is or will be retired and is seeking employment. And then between 15 and 30 days, there has to be a public meeting on the issue. When we do that, we generally give notice through the treasurer's report, and then the hearing is just sort of a board meeting. It's again in the treasurer's report, and there's an opportunity for people to speak in the hearing of the public. So it's not, the formality is minimal. It is clearly a statute that was designed to discourage reemployed retirees, but it's important. I think sometimes we forget that. So including it in the policy, I think is just an important reminder that this is a requirement.
And I only bring that up because generally we do sort of hop, skip, and jump around that. And whether it's forgetfulness or intentionally. And now, most people are not so opposed to retiree hire any longer because of the shortage of teachers, certainly. But I do think the administration should pay a little bit more attention to that requirement regarding a hearing or some sort of greater formality. So I just would like to put that on the record. Thanks.
Dr. Moffitt, do you have any comments?
No, I'm good.
Are we prepared to move this forward to the full board? All right, we'll put this on the agenda then to vote on. Good work, team. Policy 3160, physical examination. Mr. Hoying.
Again, one of these human resources policies that we haven't looked at for a while. The only update I've got here, and again, I'll bring that up on the screen, is in the unusual circumstance where we do a physical examination, tends to be if somebody has some sort of an injury or illness that we want to assure their ability to return to work. It tends to be kind of return to work certifications. pretty unusually used, but I did want to ensure that the ADA language of the need for it to be job related and consistent with business necessity is included in this policy. Other than that, again, these tend to be rare, but occasionally on a return to work certification or something of the like, we'll do a physical, or we'll request an employee to undergo a physical examination. Unusual, but probably a policy to still maintain. So glad to answer any questions on this.
Colleagues, questions, comments? No? No? All right, we'll move this forward to the full board then. Recommendation for approval. Thank you, Mr. Hoying. Policy 5321. This was my colleague, Dr. Moffitt, asked this to be put on the agenda, and I'm glad she did, because this is a conversation that is happening nationally and filling inboxes, namely ours, I believe, and other notes. This is our requirement to wear masks policy to prevent the spread of COVID-19. It was policy 5320. It was a new policy that was adopted on August 12th of 2020 and last revised on August 26th, 2021. And I'm going to turn it over to Dr. Moffitt, as it was her agenda item, to sort of, tee up the conversation for us.
Sure. Well, I think that I think we all have COVID fatigue. However, we need to make sure that our schools are safe and that our kids are safe. And I, like many of you, have probably received an inbox full of messages regarding our status on the mask policy. And so one of the things that I thought would be very prudent is as the nation decides to remove mask mandates from the state level and at national level, that we consider this as well. What is our position? Are we going to follow the guidelines of Children's Hospital, the Health Department, CDC? I think that people are asking for a formal position of where we are, and I think at a minimum, we need to keep it in the forefront so that the public knows that we are paying attention. We are very, very cognizant of the fact that masks are impacting learning, but also, as I shared with some parents, while we were going out into the schools, talking to students, talking to staff, meeting with administration, one of the questions that we've been able to ask is, how are the masks going, especially for our littles? Many of our teachers teach phonetically, and it's very difficult to do that and learn how to read if you can't see lips and you can't see facial expressions. And I've not heard one teacher like the masks, but they are able to alter their instruction so that our kids are learning and that learning is not impacted. So while we don't like the mask, we ask the students, how are they going? They don't like them, but they understand. I think that we just need to stay up to date on what our professionals are recommending. And that was the request for this. What is should this be changed at this time? Is that what the medical professionals are saying? And if not at this time, do we have any idea when?
I have a number of questions, so I'm going to turn it to Ms. Bolton first.
Go
ahead. So I would love to know, and if you do know, let me know now, what Children's Hospital and the Health Department and the CDC are saying about masks. Do we know? Do you know? Does anybody know?
I think I was hoping that we could get some information today.
Cool. Because I'd love to know. I think it's important to know what they think. It's super important to hear what the teachers say as well, so I appreciate you getting that anecdotal data for us.
Good morning. So in anticipation of this topic, we reached out to our folks at Cincinnati Children's and at the Cincinnati Health Department, specifically Drs. Kahn, Amin, and Mussman, and really had an opportunity to engage with them in conversation about this policy and what it might look like in terms of parameters going forward. So you've probably heard in the news that CDC is making some decisions this week around indoor masking. However, what we've heard anecdotally is that probably their policy or guidance around masking in schools will remain as is. What CHD and CCHMC suggested was that we consider some parameters in terms of when mask mandates may be removed. And so one of those factors that they really suggested was the hospitalization rate, and suggested a hospitalization rate of 20 cases per day, with a caveat that new variants may drive up this hospitalization rate, and also taking into account the CDC recommendations, as well as paying attention to increases in student and staff illness. They also suggested that, as we all know, that COVID immunizations are really critical to this strategy, and that we keep the pedal down on continuing to encourage all students and staff to get immunized. Some school districts in Maryland have also put masking policies in place and provided parameters of when those mandates come in and out of effect. And some of the guidance that they used, according to our colleagues at Children's and the Health Department, were 80% of students being vaccinated, 80% of the community being vaccinated, and transition rates as defined by the CDC as being low to moderate. And the final suggestion that our medical community offered to us is, what would we consider then as the trigger, if necessary, for remasking updates? So that was some guidance that they provided to us that we wanted to be able to share with you this morning.
That is extraordinarily helpful as well. Awesome. Is there any follow-up from Ms. Bolton or Dr. Moffitt right now? Go ahead.
Well, I think we're in a unique position for two reasons. I think because, we deal with young people who have the lowest rate of vaccination, but also because we deal with young people and our business is teaching and learning, even more reason not to have the mask, because it is an impediment for sure. So I also I hate any rule that we either can't enforce, or eventually people get so disgusted with it that they just stop self-enforcing. And I think we're reaching that point where it is harder and harder to even get the grown-ups to, in a disciplined way, wear these masks. So I do think that the discussion should continue. My hope would be, there should be a trigger about when to put them back on. And there probably is some data now. 80% of vaccination, that's not, we're going to be masked the rest of the universe. That's not going to happen. I don't like that trigger, because it's not a trigger. And I think we increase our credibility taking them off when it appears that we should or can, or we think we should or can, when we have to put them back on. But wearing them, and I don't think our neighboring school districts are doing this in the same manner that we are. I think they've started to lighten it up. So my hope would be that we could at least create what some people have done as a date certain, if not all of the things Children's Hospital wants, but they've got their job to do and we've got our job to do. So I'm looking at return from spring break or whatever. There has to be an end to this. So that's where I would be. But I'm really glad Dr. Moffitt brought this up, because it needs to be discussed.
Dr. Moffitt?
I'm all for, let's start the process to set the parameters and get them off, or at least have some breathing room for our kids. And I'm also wanting to note that we need to get our performances back going for our kids. I was able to go to a performance at a school, and they requested permission to take the masks off. So we need to have our kids back performing with the arts. We need to allow and have if one of the parameters needs to be that if we do maintain them, can we have some flexibility around wearing them at times of performances? Have that clearly stated. Games, I just think that we need to take some steps to outline what our expectations are for the community, and then also state that we are moving towards and paying attention that we're moving towards aligning with not normalcy, because I think that to say we're going back to normal is just not fair. We're going to have to deal with the fact that we may have triggers that make us have to wear these, but we are paying attention and we do want the best for our kids. So we could establish some parameters that include when masks can come off, i.e. performances, events. I think we can do that fairly quickly. I think that would be helpful.
This is a great conversation. Any other comments from Dr. Webb, Ms. Walton? So I have a number. The first, and sorry I had to call you back up. I know you wanted to sit down, but a couple questions, and then we're good. Question number one. So the rate of 20 cases per day. Did Dr. Khan share where they are now? Just so I can wrap my brain around this idea of what would this timeline look like?
I don't have that information. I can get it for you.
That would be rad, because if it's like 21 a day, then we can start talking about day. If it's like 50 a day, then this conversation is kind of moot, to the point of 80% of the community being vaccinated. That's not going to happen here. So that won't work for us. That would be good to know.
I can text him.
Cool.
While we're in this meeting.
Perfect. And then, and we say this a lot, and first of all, I want to thank Dr. Moffitt for putting this on here. And as one of the most adamant mask vaccine people on this board, I think it is the right conversation to begin having. I do. And I do have some concerns. Obviously, that's not a surprise to anybody. One thing I am curious about, because we say it a lot, I don't, but my colleagues do, the community does, and a lot of people say it, is that and you've heard it from teachers, and again, anecdotal data, qualitative data in the world that I work in professionally, qualitative data matters. It doesn't maybe matter as much as quantitative at times, but it should, and so I think that qualitative data does matter. Do we have, or does any exist data that does actually draw conclusive evidence that masking somehow hurts student learning? Because for me, I understand how being out of school does, even though I was a proponent of going remote many times. I understand how that can have some kind of adverse effect on some kids, not all kids. But and since you're smarter than me, I wonder, do you have data that this is real? Because we say it a lot, and I get a lot of emails that accuse us of child abuse regarding these masks. I have not seen any article that says, we talk a lot about the reading the lips. I get all this, but is that real?
So I would have to research that. I don't have it at my fingertips.
And that's cool.
But I'll look for you.
And that's cool. But I think, it tells me something that one of the smartest people I know doesn't know that off the top of her head either. We say it all the time, but nobody's ever said, and this is why. I'm just saying, I'm all about having the conversation. I'm all about moving this to the full board and saying, let's figure this timeline. But I'm not all about saying things that are potentially untrue as our reason. That makes sense. Cool. Thank you, Ms. Bunty. So what I would like to ask this committee, though, is I think this is a really important discussion to drive. And what I would love to know is, what do we want to do about this then next with the full board? Because we're probably not going to come up with all the parameters here, but my idea would be to have a presentation. I think it warrants to make a presentation, and to your point, that should happen soon. Mm-hmm. Beyond just a board matters discussion. Here's the presentation, here's the recommendations, here's where the Children's Hospital is now, and then Q&A after that. And I just want to know if you all have a better idea, or if you think that would work.
We're talking about Monday, right?
Well, I don't think we can do it on Monday, unfortunately, but the next meeting, I'd like to do it on Monday. I'd like to do it now, tomorrow, but.
Well, I think that, I don't know. I would love to do it on Monday. I do think that there's things that we need to know. We need to know the number of cases, but we can probably establish some parameters and make those recommendations fairly quickly. I don't know what is fairly quickly. Assistant Superintendent Bundy. Is it by the first March meeting, or by Monday? We could have some.
March 7th is the next one after the 28th. That's plenty timely, I think.
I just want to give people an opportunity to know that hey, this is coming, we are thinking about this, and then be able to give kids an opportunity to say, hey, they're talking about this mask stuff.
So I think it's certainly possible to do a brief update on Monday, if that would be helpful. I'm not, and then possibly a further, more in-depth presentation in early March.
That's great. And then Dr. Mowat, if you want to bring it up under like inquiries and updates, or, you know, if the minutes likely won't be ready then, which is all right, but it's definitely something to tee up, I think. Good.
Can I just say that I know that I was trying to put something on the agenda for Monday. It was kind of difficult because I know it's very full. But if the small presentation, to me, what that would mean is answering the several questions, making the statement. Will we be presenting these minutes as early as Monday? I mean, it could come up in part of the minutes.
Well, that's what I was saying. I didn't.
Yeah.
If they are ready, then that's when it happens. Yes.
So my thought is, you know, the idea that what are the other districts doing? Mike's point about what is the data about it, and then bring in what you're learning from being out in the buildings and whatever. Something very, very little, and then try to really have a good discussion on the 7th.
Yep.
If people have had a time to think about stuff. But this will be a popular decision.
I think we'll have a lot of attendance at that meeting. But I think that the good thing is that we will have people that are very concerned about masks will be able to get some of their questions answered. I don't like to hear that people are considering leaving our district in large part because we're wearing masks and they feel like we're not caring for kids. That just really, it bothers me, and I want to make sure that they get heard, that we are paying attention. So March the 7th is the date that we'll start the conversation publicly.
That's great. Thanks again, Dr. Moffitt. This was a timely to have this discussion today, as all this is really seems to be picking up speed. So the next one related to COVID, there had been a discussion, I think this may be DOA, but we'll see. There had been a discussion on an assignment made by me to this committee to discuss adding boosters to policy 5322. I don't want to assume anything, but I do think this is maybe a dead on arrival, but I'll see what my colleagues think about adding boosters to the vaccination policy. And if it's dead, it's dead. But I want to give one more chance if anyone wants to consider adding it. Ms. Bolton?
I think we're in good shape.
Okay. Dr. Moffitt?
I have to concur with that one.
I disagree with both of my colleagues, but I love them dearly and I respect them so much. And I learned how to count in grade school, and 2 is more than 1. So we'll move on. Good discussion. Sometimes, hey, look.
No, I would like to say something about it.
Please, yeah.
You've been a real pain in the rear end about protecting everybody's health, and we thank you very, very much. Because you have been the leader on this board, for good or for bad, about worrying first and foremost about everyone's health. And we appreciate it, even though we may not like it all the time, but thank you for doing that and being consistent throughout.
I appreciate it, Ms. Bolton.
And along that line, I will say that while we disagree on, at this moment, we disagree, let me put it like that. I think that the authenticity of your pursuance of this is not missed on me. I think you're doing it out of wanting the kids and the staff to be safe. And so from that perspective, absolutely, you get my kudos. I just think that the timeliness of this at the moment is just not where we need to be. But I got mass love for you. We're going to disagree and commit. I appreciate
it, Dr. Moffitt, very much. Ms. Scott?
And I was just going to add, I know that we had shared last time that the district had started asking employees to volunteer the information. Yeah. And we have had about 1,000 employees who have volunteered that they have already been boosted.
Right on.
So
that's great.
That's a pretty significant number.
What's our total number?
Total number is about 5,000, 6,000 employees.
So we're at 20%?
As far as boosted.
That volunteered.
Information. Yes, that have volunteered to give the information.
So it's more than that. Yeah,
yes.
For sure.
Mm-hmm.
Well, thank you, Dr. Moffat, Ms. Bolton. You made me blush a little bit. Match my red sweater. I really do appreciate those words, maybe more than you know, so thank you. See, kids, those of you paying attention, you know, in politics, you learn how to agree, disagree, move on, and maintain good relationships. It's an important lesson for all 12 of you watching. So we have a draft resolution that is awesome, and I'm going to let the General Counsel and Assistant General Counsel introduce this, and it is a resolution recognizing Juneteenth as a holiday. A lot of people said to me when they saw this on the agenda, like, wait a second, didn't we like get off summer scholars last summer, and didn't the federal government say this? And my response to them was yes, but it needs to be codified in policy, and it needs to be recognized as a holiday for everybody. So that when us three are long gone, this still exists. And so General Counsel and Assistant General Counsel asked that this be on our agenda, so I'm going to turn it over to them.
Yeah, thanks. I'll just say a word about it. So Juneteenth was a holiday recognized by the federal government, Chair Murawski, as you pointed out, in June of 2021. The city also announced that it would be a holiday. The board has not officially recognized it yet. It came up as an issue in collective bargaining, specifically as several unions proposed adding it as a holiday to their collective bargaining agreements. And at the time, we asked for the board to have the opportunity to recognize it first. And so we present this resolution as an opportunity for the board to recognize the holiday officially. And glad that it's a draft resolution, so I welcome any thoughts or changes on that, but also welcome any other questions about this as an issue. Thanks.
Thank you, Mr. Hoying. So I'll look, questions, comments?
Well, I just want to make sure that I say to all the 11 people, Juneteenth has always been a holiday in my house because that is my birthday. Yeah. So two things happened in history, and on June 19th, the slaves were freed in 1865, and I was born. So, of course, yes, let's make it a holiday.
That's pretty good.
Ms. Bolton.
I just have a question and then expand it a little bit. In this next to last paragraph, be it further resolved, CPS shall not schedule summer school activities on June 19th or on the day June 19th is observed within the district. That means that 2 days or 1 day?
I took that.
We intended it as 1 day, the day that it's, yeah.
It's kind of confusing for me, but I'm easily confused. But I don't, if there's a way to make that a little bit clearer.
This year it falls on a Sunday,
right?
So it's going to be observed on that 16th.
So it'll be on the Monday, according to the resolution. Right?
Well, it's going to be the 16th. What they said in the LSDMC meeting yesterday is that it's going to be observed on June 16th in observance of the holiday, which is actually the 19th.
But even in this, then it talks about the Monday or the Friday based upon when it falls on a Saturday or Sunday. If we just clear that up and make me less confused. Because the federal government determines, and they do it either on the Friday or the whatever, on Saturday, Sunday. What's the deal? I think it's.
Yeah, let us look at that one more time because we had written this up. I'm perhaps before I do see that it's going to be recognized. I think on the 17th. Is that right, Dr. Moffat? So if the 19th is a Sunday, Saturday the 18th, June 17th, is that when it would be?
Well, I don't know. Just in the summer school, in the information from the LSDMC meeting yesterday, they talked about it being on the 16th.
Okay.
They would observe it, so that's why I got that number from. But I don't.
Let's make sure. We'll make sure we get this cleaned up to accurately reflect what the date will be before we present it to the full board.
It could be the national government that decides which day it's celebrated rather than maybe how we've done it. But I think it's fabulous, and I really, there's been a few people in the community that have really kept this alive throughout efforts. And I know many of our teachers have participated in this with readings and what have you, and teaching about it. What I'd just like to expand is and ask, I don't know who knows this. I've had a number of people reach out as to, do we have a calendar for next year?
Mm-hmm. We do? Yeah, I've had a lot. I'm glad.
A lot of that, yeah.
And the other piece of the calendar piece is that the calendar used to work its way, it's a collective bargaining agreement issue between CFT and the administration, and then it used to work its way through student achievement, which it has not been doing recently. And I would suggest that the calendar probably needs to be something that comes to policy committee. And the other piece is when board staff did the board calendar as such, we were recognizing a number of holidays, not that anybody was off, but a very inclusive calendar, which included, even before Juneteenth was determined, it included Juneteenth. It included the most important Islamic holidays. It included the most important or most significant, most celebrated, however you work on that, within Judaism. I just think that our calendars don't do that. They are not inclusive of our population. And so I just kind of think that moving forward, yes, granted, CFT and the administration get to outline a calendar, and it comes to the whole board for passage. But I think that you need more community involvement in that than just a bilateral arrangement between CFT and the administration, and that would have to come through a board committee. And I don't think it should be student achievement, because they would be focused on instructional days, whereas we would be focused on other stuff as well. So it's just something hopefully in the very near future. But if you say we've got a calendar, I think the public would be glad to know.
We do have a calendar, and I think it's slated to come before full board on Monday. However, we can pull it and have it come to policy first if that's the desire.
Well, we can't wait for it to come back to policy. And the board won't want to be the one that looks like we are delaying it. But maybe if you could shoot it to us.
Sure, I can do that this
so
morning.
that we can at least, and then we can maybe, again, this big meeting on Monday, for goodness sake, is already full, but then maybe we can talk about where it needs to come the next time. And is it 2 years or is it 1 year?
The one that's coming in for Monday is 1 year. However, the next 2 years are in the process of being completed. So we can certainly bring those forward to policy if you all would like that to be considered as a possible agenda.
I think we probably have no hope about changing anything or doing anything about this one that we're going to see, except making it more inclusive. But I will say the next 2 years, the community in the suburbs, the community is involved with the formation of the school calendar. And it's another one of those things that if you God forbid, let the board or a part of the board do it, it means the community is participating.
I think that honestly, we've heard that from, it came up around the Bengals Day, and
yes,
why that day wasn't on the 7th versus the 14th. It was kind of an interesting perspective to educate the community on that. But I think in the best interest of planning, people want to know as early as possible. I'm like that. If I think other people are like me, if we can get out as much information as possible, and even if the 1 year calendar is set, but the 2 year calendar is tentative until the next, we can be able to get out for families the instructional days. And I'm all with you, Eve. Let's definitely include holidays that are non-Christian holidays. I think that is super significant, and I think that would also help our families with their planning as well. And it would really, it could be a teachable moment that the teachers could utilize those in the classrooms to talk about other non-traditional holidays. So for sure.
Thank you, Ms. Bunting. Thank you, Dr. Moffitt. Thank you, Ms. Bolton. Are we good to move on? Mm-hmm. Yep. Editorial aside, I agree with Ms. Bolton about the need for this committee to look at it, and I also agree with Dr. Moffitt a great deal on the need to look at holidays that traditionally we may have overlooked. Of course, as we know, since I've been on this board, been caught not acknowledging holidays that are not unknown. So I appreciate the attentiveness to detail. The next agenda item is something new that I put on here. You may be aware of this, you may not, so I'm going to introduce it, if I may, and I will let you know. I always like to start at the end. And the punchline of this conversation is I would like to suggest that the Cincinnati School Board draft a resolution in support of this resolution that the state government is currently kicking around. I will let everybody know that on March 10th, I'll be in Columbus testifying as an individual on behalf of this who works with, people in the community. If the board decides to do this, I will then be testifying with your blessing, of course, on behalf of the board. But I just want to introduce this briefly. It's what it says. As you know, the state of Ohio has determined racism is a public health crisis. The county has, the city has. Along those lines, this resolution would encourage the governor to declare a state of emergency on childhood trauma in Ohio. Obviously, we doing what we do up here, we know that this is an issue that's only been further compounded by COVID. It's an issue that Assistant Superintendent Bunty, who we've seen many times today, thinks about every single day in her work, and having implemented, PBIS into our schools, trauma-informed care, et cetera. This resolution came from a man in Cincinnati named Ron Hummons, who may or may not be familiar to you. And Ron's son very, very, very tragically murdered police officer Sonny Kim, and then, of course, was murdered as a result, or killed as a result of that. Ron, for years, and I have, Ron's blessing to talk about this. Ron, for years, was trying to help his son and had a very hard time being able to help his son. His son was living in an environment that wasn't great and had some issues, and the courts didn't really want to listen to Ron, and we know what happened. As a result, Ron has kind of been on a mission to do this. We know that what childhood trauma does to our students, and so he's been going to City Council quite a great deal. I'll be testifying at City Council, and I don't remember the exact date, but I am at some point soon. Again, as an individual, or perhaps in a different role if people are fine with that. But I've given you the resolution to look at and to read. If you didn't get a chance to look at it before now, that's obviously okay. With everything we do, there's a sense of urgency, but this is not like we need to get this done today. I want people to be able to take time with this. I do think it'll happen, and that is because Ron has secured co-sponsor Tom Brinkman to join Cedric Denson. And we know Cedric from the 33rd District and Representative Tom Brinkman from the 27th. And, Representative Brinkman and I have spoken on the phone a great deal about this. Same thing I said to Tom, he's an unlikely person perhaps for this, but Tom knows that this trauma has adverse impacts on everything. And while Mr. Brinkman and I may have different priorities, the priorities Mr. Brinkman has are impacted by this trauma, as much as ours. So the resolution essentially dictates, whereas I'm just going to pull out a couple things for the public's edification. Whereas law enforcement, juvenile justice systems, substance use treatment centers, education systems, social service networks should all be equipped with up-to-date knowledge and training on trauma-informed, trauma-responsive care. This resolution lays out that this is a problem, but then it also gives the state the ability to invest in these things. And of course, the powerful thing about resolutions, and many people, when I worked on the racism as a public health crisis at the city with former Councilman Sittenfeld, a lot of the arrows shot at that were, who cares? You're saying racism is bad. And I would explain to folks who don't do what we do for a living, the reason this matters is because you have to say there's a problem before you can start investing actual public dollars into it. You have to acknowledge, it's kind of like an alcoholic. I'm not going to get over it if I don't acknowledge I have a problem. So that's where I think the power is in this. I truly believe it has a good chance of passing with Representative Brinkman as a co-sponsor. I really do. He has asked, would this be something the school district would be willing to support? And whenever Tom Brinkman asked me to mess with the school district, I'm like, I will see what I think that could be a good idea. So I present this again with the desire that we would consider as a committee to recommend to the full board that we draft a resolution in support of this. And again, it doesn't need to be for Monday, and we don't need to hurry up or anything, but I'd love to know your thoughts.
I think it's the right committee before. I think it probably should be shared with health and safety to have even just as a heads up. I'm very supportive of it.
Great, thank you.
I'm extremely supportive of it as well. I think trauma has impacted every single one of our students and many, if not all, of our adults right now at this moment. So I am definitely supportive of this. I agree, health and safety should weigh in. I think that we would get the support of that committee as well, but I think that we could definitely get the board's support on this.
Well, I appreciate that. Thank you. And I can get with Chair Weinberg at Health and Safety about this as well, and let her know that we spoke about it. Would it be prudent to ask General Counsel to begin drafting a resolution so that we don't always have to wait till the last minute?
Sure.
Okay. So assignment, thank you all. This has been great. To General Counsel to draft a resolution of support, pending obviously a board approval, have health and safety weigh in, and great. Appreciate the conversation. I think it's a really important thing, and it's something, Ohio is not always first at stuff, and the things we are first at suck. We're the best at not investing in children's services, for example, but this could be a really, I think, progressive thing to do. So thank you, Tom Brinkman. It's something I never thought I'd say public, so there it is. It's on the record, and I'll let Tom know about it later. I'll expect him to thank me when I'm at the State House. Next, this is one of the most important things we do, and I apologize to everybody that we did not do it at the last meeting. That is my fault, 1,000%, and that is to approve our work plan. You have the work plan in front of you. It has some red line changes to it. You also had in our email inbox, you had all of the sort of policies and when we've reviewed them. And I'm going to turn it over to my colleagues for comments, but real quick, if you all will stick with me, I'd love to ask Dan Hoying, since I've been on this board, because I was on policy committee the first year, not the second, and then the past 3 years, and we started this process in 2018 when Ms. Bates was chair, and it was Ms. Bates, Ms. Bolton, and myself, and we have really rocked it. I mean, how many of these policies have we gone through? Or maybe better question is, how many do we have left? And then I'll turn it over to my colleagues.
Yeah, we have rocked it. And I would add to that, the Finance Committee also did its part on reviewing all the finance policies as well. So, we should be starting to review the work we did in 2018 at this point. So,
great. Wow. Okay. So you have this work plan in front of you, and I'll turn it over to my colleague.
Yeah, Member Moffitt and I attended last night the district-wide LSDMC meeting, where indeed our DEI administrator presented regarding the equity and anti-racism issues and policies, and especially as it pertains to LSDMCs. And we learned things that I don't know that the board has heard. And I'm not. I'm very happy that the LSDMC folks heard it, and they needed to hear it based upon the policy, especially about the subcommittee. But it gave me pause about our work plan, Mr. Chair. And I would like to think about us tabling this, or at least having more opportunity to work on it for next month's adoption, since we know what our work is and we are in that cycle. The reason being, I think based upon what Member Lindy had put forward, and we had a number of policies we were particularly paying attention to.
Mhm.
Based upon we're in the last year of the strategic plan, and part of the work plan is about the strategic plan and looking at it. Some of it seems not so policy oriented, but it did get thrown to us, rightfully so. It wasn't any place else to put some of these things. And also knowing that we did kind of separate the work from the philosophy policies, it might elevate our work to focus on some of the bigger things as conversation. I mean, I think there's, it's not going to be reinventing the wheel, but it might make it more relevant to what we do. So I'd like to hold it for next month, and then maybe if we find a way to talk with one another, or if you want to appoint a couple of us or whatever, I think we should hold it and make it more what we're about or what we've been being about.
I'm fine with that. And as long as Dr. Moffitt's fine with that.
I'm fine with that. I think honestly, one of the things that, some of the things that we learned at that meeting yesterday need to be reflected in this plan. And you haven't heard the plan, you haven't heard their research yet. So I think it would be very prudent to have that presentation made to us so that we could it could impact what we do moving forward. I'm with it.
Great. And as far as working group or whatever it is, I think probably the best, easiest, and legalist way to do it is y'all and just shoot if you want to go through this like we did with the philosophy versus the work. If you want, and just shoot me or just bring them in March. But it'd probably be best to shoot your revisions or additions. I can get it all to General Counsel, and then we can have a new. And I'll do the same. I'll do the same with my own piece of it. Is that, and if that works for y'all and it works for, okay, nods. Okay. So our next meeting, I'll give, as a good former teacher will, I'll give us a little bit of a deadline. So our next meeting is on the 18th of March. And so I will just ask that we have all of this, and I'm looking at Mr. Hoying and Ms. Scott. Is a week ahead of time sufficient, March 11th, or would you like it sooner?
I believe that's sufficient a week before.
March 11th?
Great.
Great.
Yep.
All right, so 3/11 day, excellent. So March 11th, we will have all of that info to y'all, and great. And I appreciate the suggestion, Ms. Bolton. I think it's appropriate. I think this committee has morphed in the past few years in a lot of ways too, and I think it's a good idea and prudent to reevaluate it. Great. Cool. The next one, we're going to stick with Ms. Bolton, turn it back over to her. She has been, in the same way she complimented me, I'm going to say, there's been nobody on this board that has kept the transportation issue in front of us as adamantly or passionately as Ms. Bolton. So we have 3 policies regarding transportation. We have a number of red lines, and I'll turn it over to you, Ms. Bolton, and if you want to turn it over to Dan, feel free, but it's yours.
Yeah, very much would like to have General Counsel kind of brief us on how you all changed what was the proposal. I mean, I noticed a couple of things, but maybe if you can go over some of those and your reasoning for some changes and some additions. I also was, the superintendent called me a couple of days ago and was concerned, rightfully so, about anything moving forward too much before they had some more information about how what's reasonabless of the implementation. And so I said, well, I don't think there's any chance that anything's going to move forward from policy. But I don't want administration also not embracing what is going to be new policy as we kind of outline and further investigate whatever is the transportation plan that's taking shape. So it's a chicken egg or whatever. So I know one of the things was the distance piece or the time of travel was of concern, I think, rightfully so, to the superintendent. you know, 75 minutes to 55 or what have you. But again, policies drives implementation. And I think part of the problem with transportation has certainly not been the administration, but it's that the board didn't have the right policies in place for transportation. So again, chicken and the egg, but if we can have some discussion, I think there's a great common ground for the administration and the board on this that could help us all. So if you could either react to that or share some more information, or at least show us the things that you felt needed to be changed from not only the original policy, but some of the proposals, I think that'd be great. Muted.
Yep, sorry. Yeah, so updated policies 8600.01, 0.02, and 8650, consistent with some of the notes that Board Member Bolton put together, along with the discussion from January's policy committee meeting. 0.01 was updated to sort of broaden the concept of what it means to safely transport a student to and from school, incorporating some of the concepts that we talked about. Board Member Bolton mentioned that expanding that concept to include kind of the transfers, you know, students getting on at a safe bus stop, transferring from one bus to another if that becomes necessary. So that's 8600.01. I'll bring it up and welcome any questions or discussion.
I have a question about that. While you're bringing that up, I see that you all have taken out, while being transported, the transportation contractor is responsible until the children reach their destinations. I think that we need to have, and it's kind of clear in here where it says the children being transported, parents and guardians of children being transported, that the parents are responsible for their children's safety and well-being until they board the bus or van for departure, and again when they return. I also think I don't see anything wrong with saying who's responsible while they're being transported. So I was wondering why you all took that out. It just says while being transported, the transportation contractor is responsible. Why did we take that part out?
Yeah, didn't reworded it. It's still at the second sentence of the second paragraph here. Transportation vendors that contract with CPS share the duty to ensure the safe transit of students to and from school, but we can certainly include or revert back to what previously was included, which is while being transported, the transportation contractor is responsible until the children reach their destinations.
I just think it's a little clearer for parents that may want to read that. It may, you know, that it's just a little bit more lay termish, which I like.
Got it.
Were there any other changes that you made on 8601?
No, that's what I've got for 01. 02 gets into a little bit more of the procedural aspects of it, so I can switch to that if you want.
No, I have something to add or ask about.
Sure.
And that is in the, I guess, third paragraph, or where it says transfer hubs.
Yep.
Do the only, I'm ashamed to say, I might be following transportation pretty carefully, as the chairman mentions, but what's a hub or the big general areas, right? Where there is a combination, a coalition, a confluence.
That's
right?
what I had in mind, yeah.
The side that I'm very familiar with, and the one downtown.
That's what I had in mind, yes.
Okay, those aren't necessarily the only places where our kids transfer.
That's right.
So
Maybe
my concern there is that the transfer hubs are appropriately supervised. If our children and our teenagers are transferring someplace else.
Yeah, so maybe transfer locations.
Yeah, that might be helpful. I mean, that is one of my huge, huge concerns, and why we've, been contemplating some of these other changes. So that would be of interest to me. And then as well, it's my understanding that beginning this next school year, if your child goes to a charter school or a private school or whatever, a non-CPS school, we're transporting them, they can't have any more than one transfer. Now by law, it's my understanding. I think that was in our board, the newsletter we get every, couple of weeks, where they were describing it. And so I would hate to think that we weren't building in some kinds of limits regarding that. So if general counsel could look that up, I mean, I think I can refer you.
No, I think that's right, and I can add that as well.
Yes, and I will tell you that there are a couple of board members that are proposing, and we've said it publicly now 3 times, that if any of our students that don't have any transfer can take the regular routes. But if any of our students have one transfer or more, we need our extra routes back for those. And it's really kind of divided evenly, half and half, as I understand it. But we've gotten some different numbers recently from Metro that appears that nobody's transferring anywhere, which is interesting. So I would change that hub word. I mean, they're phenomenal, and they are pretty properly supervised. The hubs are. But it's not only places where our kids are transferring.
Got it.
Thanks. And I agree with Member Moffitt on putting that other back a little bit more clearly. Thanks.
I can go on to 8600.02 if that.
Great.
Okay, so
The chair.
Fine, me. That's the big one.
yeah, this policy generally puts kind of in place what transportation the board offers to our own students as well as charter and community non-public school students beyond what minimum state law requires. So at Member Bolton's suggestion, we included, first of all, what are the requirements for transporting students by state law, and that is students in grades K to 8 who live more than 2 miles from their assigned schools have to be offered or afforded school transportation. Beyond that, this is always, kind of discretionary with the board on how much transportation is right for our district. And so that, the changes, the major changes, I think you named them, Ms. Bolton. We incorporate some of the things that we are already doing within, school transportation. There was an open question, I think, about whether K to 8, we're going to switch to straight yellow bus or not. And I think that's probably something still under discussion with administration as well. It's probably something the superintendent raised as that we're still investigating. If we switch to K to 8 full yellow bus, then what does that mean in terms of our high school transportation and 9 to 12? I kind of left those as open issues because it felt like from our last discussion in January, they were still open issues. And then, again, lots of clarifying language, but one proposal that was made in your version also was that we reduce the maximum amount of time that a student would be on the bus from 75 to 55 minutes. So those were the major proposed changes. Glad to answer any questions on this policy.
I do think that there are some open questions depending upon implementation. But again, you don't build implementation around what is doable. Initially, you build implementation, build around what is the ideal. I think the board, and we haven't had a vote, and this is part of the confusion always with this, in this district, is we don't vote on a lot of things. Thank God. But I think the board is pretty resolved in a consensus around the fact that we're probably wanting our 7th and 8th graders to be transported by yellow bus, unless their families choose to do differently because of the high school or a pass or something. That seemed to be the real force last year and this year. So I think that's probably reaching a consensus thing. And it's hard for the administration to read the board's consensus, but when we say it over a number of 7 months, I think everybody should get the clue on that one. And I do think that people feel very strongly, the community, that 75 minutes of transport is too long for the kids. So, and we don't know if it's doable or not, but I think if we're not trying to design something around what we want versus what we think we can do, we'll never know. Those are, you're right, they're open questions, but I wouldn't want the administration to think they're unresolved necessarily. The other piece of it, I invented some word here, but it in the first page of that, in the second paragraph, the district direct transportation, so that's a fleet. That's a district fleet. And I know that in finance, people are trying to look and see the cost of both the yellow bus. We can never transport all of our children, but there are things that we can use dedicated buses for. That would be good. So that the direct district, whatever, just say fleet or something. I don't. On the second page, Dan, what is B? Students in grades K-8 attending elementary schools whose residence is 1. Does that impact the kids that are in the K-12s? Does that language speak to opening that language up?
So B relates to students in grades K to 8. Is that what you're asking?
Yeah.
Oh, and I think previously there was a separate section that related to K to 12. There is here, and it followed the 1 mile rule.
Okay.
I'm getting a little bit out of my area here, but I think the rationale there was that if you've got siblings, that you want a similar transportation scheme in place for siblings. You don't want, in the same school. So if you've got a kindergarten attending the same school as a 9th grader at Riverview, I think the idea is to have the same scheme in place for both those students, notwithstanding that they're in different grade levels.
Okay. And so the language, that particular language there is reflecting that.
That's what had been included. I think that the draft I got took that out, but
Okay, cool.
It would make sense. I don't know. It would make sense to me that you have the same transportation scheme in place for an entire school.
Yes. And then just out of someplace else, if you will, I think we're starting to recognize that we don't. We have a very narrow definition, legal definition of magnets that we've expanded over time. We have magnets that are really not magnets. And I think too, if we could put in a magnet, that's fine, but also I think we have to start putting in that our Montessoris are not magnets. It's a complete Montessori system. And probably public needs to see it that way. So, and I think Dr. Brown was getting back to us about magnets and what are our magnets, what aren't our magnets. And now without Mrs. Bates around, she can't tell us the extreme list of what was ever justified as a magnet or what have you. So, so if they can work in the magnets and Montessori in
Sure.
there. And then the other is that 30-minute rule. I think you guys shed light on that. There's something too in the new law about the time.
The 30 minutes still applies to, that relates to our obligation to transport a student in a private parochial or non-pub community school. And the rule is that it's 30 minutes. If the time it takes, direct transportation time that it takes to transport a student to that non-public school exceeds 30 minutes, you don't have the obligation to transport them. So, if a kid wants to go to, Dayton Alter, presumably that's more than a 30-minute drive, that their transportation is on their own. However, kid living in Silverton, wants to go to Moeller High School, even though it's outside of our district, it's still our obligation to transport that kid. Does that make sense?
Yes. And in that new law too, in the other law that I referred to a little while ago, about transfers, there's also some requirement that kids will be delivered to and from school or whatever within 30 minutes of start time. I think we have that somewhere, don't we?
We do. And sorry, that is a separate requirement that the
Right.
drop off, it can't be any more than 30 minutes before school or picked up 30 minutes after school.
And
That is in here, I think.
That would be good, because that's obviously not happening, or if it's happening, it's only happening in Yellow Bus. It certainly is not happening in Metro. Yeah. 15 in here. That would be the law then.
Number
That's
3 is 30.
Here it is.
As long as it's in keeping with this, because they just passed this in the last couple of months. Freaked everybody out, including me. Okay, then I know, did you remove that it can't be any less than an assistant superintendent?
Only because generally, I don't think the assistant superintendents tend to be involved in transportation. It's the department's under the COO. But I gathered that you're, maybe I'm wrong, but I gathered that your concern was that it not just be at the transportation department level, that those approvals or exceptions be made, that it has to be above the transportation level. Am I correct there?
Yes, and it shouldn't be the superintendent necessarily just appointing somebody. It needs to, I wouldn't mind if it's the COO or whatever.
Okay.
We just lived through this horrible experience for the last few years. And I think transportation is about the only thing that actually goes through all 5 or so segments of our strategic plan. It touches everything. And we can't do our strategic plan and I think if we have any failure in the strategic plan besides COVID, it's that transportation has hindered us from doing any number of things in it. So yeah, I'm okay with COO.
Got it.
I don't mean to try to tell you all how to do your business, but I am on that one. And then the other is add co-curricular where it's extracurricular activities and instructional time.
Got it.
That's number 3 or something. C3 maybe. And I'll stop in a minute. I'm sorry.
No, you're fine.
C3, just add.
Yep, got that.
That'd be great. And do this. Starting, ending time. Schools.
I had a question about that.
Yeah.
Because for me, if you have a 7th or 8th grader who is getting yellow bus service, are we giving them Metro passes too to have the extracurricular activity pass? Because typically those were for the extra routes, and those extra routes they had the Metro passes for. So are we saying that a 7th grader who stays for football practice and needs to get home will not have yellow bus service? Now they're going to get a Metro card with how does that work? That's not clear to me.
I think we added that, that's why we were saying some families can choose if they want their kids, their 7th and 8th graders, if they're in, they can choose to put them on Metro and have the full benefit of Metro on that.
But what if they don't
But if
wanna-
they don't want to, yeah, they would
So
have to
that-
be able
so
to get
then-
past.
We have an extra, that student just cost us extra money.
No question.
So they're getting yellow bus service, but they're choosing to stay for an extracurricular activity, which would require them to have Metro service. I just think that needs to be thought out more because the way that that's written, it's
Good.
written for an extra service, which was Metro.
Yeah, that's a good point.
Unless we can get Metro to come up with something that would give just a restricted hours pass for after-school activities, which is what the extracurricular activity pass did. It was only for after school, but it provided, it was so that they could use their Metro Extra Pass after hours. If they don't have a Metro Extra Pass and we have to give them that, that's just an added expense. I just think we need to think about that more.
That's good. And then there's this stipulation about transfers. I do think in F, there has to be it's a PK just because of the kids with special needs at preschool are included in have us having to provide transportation. And then finally, it's at 55 minutes instead of 75 or whatever it was. And then the difference, the operation, we've got the 15 minutes. That's good. That's in there. And the differences between what CPS kids get versus non-CPS kids get. I would hate for our CPS families to think they're getting less transportation service than the non-CPS families are with some of those new regulations pertaining to charter and community schools or whatever they're calling it. So if general counsel can be aware of all those things.
The only thing that I had, Dan, for H under 1 with regard to the 75 versus 55 is that we actually have had students on extra routes take 75 minutes to get to school. So
Oh, absolutely.
that is and that was on an extra. So I'm nervous about reducing that to 55 if that is unrealistic, because logistically speaking, we could have a student on the west side want to go to Woodward, and there's no way to get there with the timing of the routes, particularly since we're not doing extra. I don't know if 55 is realistic, and if we have the data to prove that.
Okay.
That's my only
Good point.
Go ahead, Dan.
No, that's an area that we need to follow up with transportation on as well. And I expect that was the other issue that the superintendent maybe reached out in terms of wanting to make sure that we had the capability to do.
With it. Okay.
Good, Dr. Moffitt? Good. Ms. Bolton? And Ms. Bolton, I'm going to pick on you one more time. There were a couple little mini assignments I heard made. So at this time, any further action we want to take with these, or move on, put them back on here next time, or are we ready pending some changes to recommend approval?
I think they has to come back
Okay.
with suggested changes, and also another month where we'll be in a different place regarding the transportation knowledge that we have. Did we do 8650?
No, that was the one with just a couple little red lines. We did not.
I think
It changed a couple word changes and like a sentence here and there.
I would just add in the first sentence that it might, after it's contracted or district-owned vans. I honestly believe that this district is going to have some vans that it owns, and I think it's going to have some yellow buses it owns. Yep, that's all it was.
That's,
Thank you for all that time. Appreciate it.
no, always. This is really good. This is transformative stuff. So we're moving on to other business. We are not going to have our visitor. That was an agenda item 1, so we'll move that to the next month. Other business, and while we do this, if you are watching, one of you 10 lovely folks who are watching, during this time right now, in the next couple minutes, please go ahead and raise your hand if you would like to speak. You have 2 minutes, and please state your name, your affiliation to the district, and your topic. If you would like somebody to follow up with you directly, please note that as well. And our fearless digital leader, Rob, will put you in the queue. Other business. I have one piece of other business. Any other business from my colleagues?
I do.
No from Dr. Moffitt? Yes from Ms. Bolton?
Yes, our wonderful IT folks have been working hard on the bubble maps and have reached a number of production, so to speak, as well as been working on the issue of neighborhood alignment regarding the bubbles, if you will. And the bubbles pertain to from whence our kids come and to what school they go to. And so I think we need to devote some very significant time in the next meeting, Mr. Chair, to going back to whatever or however we called that. It was the
Was it the, well, we're looking at the
we-
Meridian
we had
neighborhood
the
schools, the whole
Meridian
nine.
proposals, not the plan,
Yeah.
but the neighborhood alignment
Yep.
and attendance boundaries and possible discussion, larger discussion about anticipating some changes in how we organize the district. So it would be great because I think Jeremy is ready with some information for us and some good visual stuff. And I know Rob was helping me and board staff extensively on looking at what we have. So that would be great.
So I say we have Ms. Davis here, so we'll note that on the next agenda in addition to everything else we've done. We can list it, I think, as boundary lines unless you have a better grade. And we'll invite Mr. Jeremy to come present. And then Mr. Rob is already here, so if he has anything to add, we'll just call him on up. Does that sound good?
Perfect.
Great. And just let everyone know, Ms. Bunty already got back to us. And so we were talking about earlier in the meeting this idea that we need to start having a conversation about the masks and if and when it's time for them to, maybe be removed. And Children's Hospital, Dr. Khan had noted that, 20 hospitalizations a day would be a decent mark. And of course, we asked, well, what are they now? And so just so my colleagues know, the 7-day average today is 48 hospital admissions a day. 48 for COVID. So that's good info for us to have as we talk about it with the board on Monday. I just would love, Ms. Davis, if we could have that reflected in the minutes, but the minutes from before, maybe so it's kind of germane to the conversation we had before, Ms. Bunty. So the answer is 48 hospital admissions per day. Okay, and so with no other business here, last call for business, no business. Anyone want to talk to us?
We have Leslie Mooney from Fairview Clifton School, a parent and LSTMC chair.
Great. All right. Welcome, Ms. Mooney. Good to see you. We can't see you yet, but we will in a second.
Ms. Mooney, will you accept the, there we go.
There it is. All right.
Go ahead, Ms. Mooney.
Oh, hello, can you hear me? I'm sorry, I'm trying to get my video. There we go. Hello, looks like Kareem can see me at least. Hi, Leslie Mooney. I'm a parent and also LSTMC chair at Fairview Clifton Language School. I just sent you all a a lengthy email, but I was pleased to tune in this morning. I always love the policy committee meetings. And I appreciate your thoughtful dialogue this morning, particularly on the math question. I have actually just sort of started to kind of tiptoe my way into thinking about this, and then I, of course, dived headfirst into all of the research. So to Board Member Marati's question to Assistant Superintendent Bunty this morning about data, I sent several links in the email that I sent because there have been quite a few scientific studies regarding different aspects of how wearing masks all day affects the learning, and certainly the social emotional learning, developmental learning in our youngest students. Pretty extensive, scientific evidence there that it is a negative impact. And I think particularly considering the diverse needs of our students, it's something that should really be seriously considered. In addition to what we just heard from CCHMC and our other sort of COVID health professionals, right? So I think there's, as always, just as I advocated for in the remote learning conversations, there's a balance of looking at children's health, not only in terms of spread of COVID, but the bigger picture of children's health, right? Mental health, social emotional learning, to try to avoid even further detrimental impacts to our children than we've already had. So I would just encourage the board members. I appreciate the conversation. As I said, I think it would be a huge, huge, huge boon in terms of mental health bouncing back if we could go to an optional masking policy, especially with the wide availability of vaccines, not only for our children, but also for our community. So that's all. Look for my email, please. Thank you. Appreciate it.
Got your email and appreciate the links. It's the most data anyone has sent me regarding that. So I appreciate you following up on the assignment so quickly. So give me something to read during lunch. Any other people want to talk to us? All right, Ms. Mooney, thanks again so much. Thanks for what you do for your neighborhood school. We appreciate it, and for Fairview as well. So we'll see y'all later in March. Oh, my one piece of business. I have another business. I got all caught up in your business that I forgot my business. Can this committee move our June 17th date to June 24th? Same time, same place. June 17th to June 24th.
Let me check around
You know,
birthday
you laughing at me?
festivities.
Right.
Are we?
Oh yeah, we're closed. Yeah, well, yeah, we're closed anyway. Yeah, so we're not. And that's exactly why it's not because I'm at a music festival with my son in Tennessee. Can we move it to June 24th? Yeah, we'd be closed anyway. So that worked out well. You can?
I'm fine with that. I will be on the birthday trail, so that's fine.
You sure?
Yeah,
All right, cool.
it's my birthday weekend, so yeah.
All right, we'll celebrate your birthday. Great. Without any further business to conduct, I declare this meeting adjourned.